Good morning. My name is Lacey Nobles. Welcome to the City of Lubbock COVID-19 News Conference. Our panelists today, Catherine Wells, Dr. Ron Cook, and Mayor Dan Pope, have a lot to talk to you about. So let's get started with Director of Public Health, Catherine Wells.
Thank you, Lacey. It's great to be back. I hope everybody had a really great spring break. Today, I really want to talk about vaccines. The number of people seeking vaccine at the Lubbock Hub site at the Civic Center has really decreased over the last 2 weeks. Yesterday was our slowest day ever at that clinic, or slowest day since the 1st of January. And we only vaccinated just over 1,000 people. I know that might sound like a lot to some of you, but that clinic has the ability to vaccinate over 2,800 people per day. So we really want to see more use out of that clinic, and we want everybody that's eligible to come on out and get vaccinated. Yesterday, we received some really good news from the governor's office. Governor Abbott announced that any adult who wants the COVID-19 vaccine is now eligible. This means that anyone who is over 18 years of age can come to the Civic Center to get their vaccine. You can make those appointments through Select a Seat or by calling the health department at 806-775-2933. Now is the time to get vaccinated. There's no jumping in line anymore, and there is no need to wait. Over the next 2 weeks, we want to vaccinate as many people as possible through the Civic Center. We want everyone to start that vaccination series and get that first dose. The hub site at the Civic Center is slated to close at the end of April. And to ensure everyone who comes in for their first dose is able to get their second dose, we will begin ramping down the number of first doses available starting April 6th. We have to build in that time, that 4-week time between the first and second dose. We want to make sure that we get everybody into the Civic Center for that second dose. We still encourage appointments, and that appointment ensures that you will get vaccinated that day. However, we are also implementing on-site registration, and you can register on-site up to 1 hour before clinic closes. So today we have on-site registration up until 3 o'clock. Tomorrow is our evening clinic, so we will accept on-site registration until 7. And then we also have clinic scheduled for Saturday, and we will take on-site registration until 3. Again, if you want to get vaccine, now is the time to come and get it. Don't wait. Starting in April, we're going to see more pharmacies and physicians' offices that will begin to have vaccine available. And this is what's going to allow us to stop the operation of the hub site, and the health department will begin to focus on targeted outreach. The goal of the hub site was always to get as many people vaccinated as fast as possible, and I know we have done that, but now it's time for the health department to focus on smaller events to reach pockets of people who have not come to the clinic. We will set up in churches, community centers, apartment complexes, and health fairs. And we will also have a team that can continue to go out into people's homes and vaccinate those who are homebound. If you are with an organization and would like to set up an outreach event, please call the health department at 806-775-2933. We want to make sure that this vaccine is available to everybody in our community. And with that, I will turn it over to Dr. Cook.
Thank you, Catherine. I want to again say thanks to all the people that have come down and helped out at the Civic Center in this vaccine process that we've done. So thank you for all the volunteers. I want to also say thank you to Catherine and her team at the health department. I want to say thank you to Mayor Pope, to City Manager Jared Atkinson, and Mayor Pro Tem Steve Massengill. Those people have really leaned on Austin to make sure that our community has received the amount of vaccine that we have now and how much we have given out in the past. And it's because of these big vaccine clinics that we've had so far that I really believe that's part of the reason why our numbers of COVID have significantly fallen off. We, as Catherine said, we have plenty of Pfizer I'm sorry, Moderna vaccine down at the health department at the Civic Center. So please come out and get your vaccine. We have all three vaccines in the community. That includes Moderna, Pfizer, and Johnson & Johnson. However, the State Department of Health out in West Lubbock have access to the Johnson & Johnson vaccine. You know, our whole goal for our community, the health department, my role, the mayor's role, our whole role was to avoid you from catching COVID vaccine or COVID disease by giving you the COVID vaccine. That was our whole goal, is to push this down so that we can get back to normal. I know that you have heard something about what's called long-term COVID or long COVID disease. Many people who have been infected with COVID, even in the mild form of COVID, have significant symptoms that continue to prolong and hang on for weeks and months after they get COVID. And the way you prevent that long COVID disease is get your vaccine so that you don't get sick. There are numerous reports of this. Even the NIH, National Institutes of Health, have decided to study the long-term lasting effects of COVID. Many of you may know somebody that have these effects or these symptoms, and these symptoms include extreme tiredness or fatigue, some shortness of breath, maybe chronic chest pain that's not related to coronary artery disease, even brain fog, where you have trouble concentrating and focusing, and troubles with memory, troubles with insomnia, heart palpitations, funny things like pins and needles, or funny sensations in your hand and your feet, something, or even depression and anxiety. Our goal for you is to get your vaccine so that you don't perhaps end up with this long-term COVID syndrome. So all the more reason to go down and get your vaccine. Overall, we're in a much better place than what we used to be. Even 3 months ago, we're much better than what we were 2 months ago or even a month ago. And I think we've done that by continuing to wear our mask and social distancing, and most of all, getting your vaccine. We want you to get your vaccine so you don't get sick. Remember, vaccines don't fix this disease. Vaccinations do. That means a shot in your arm. Please come down and get your vaccine. We have plenty for you. Please make an appointment to come get your vaccine. A lot of people ask me what the best vaccine is, and I will say it's the one that's in your arm. So please come get it as soon as you can. That's all that I have. Let's continue our trajectory of decreasing vaccine. So come get your vaccine. Mayor Pope, it's to you.
Thanks, Dr. Cook. Good morning, everyone. I just really want to thank Ms. Wells and Dr. Cook. I think we all really appreciate what they have done for us and continue to do. And so, Ron and Catherine, on behalf of the community, thank you. Second, I want to just continue to remember and empathize with those of you that have been impacted closely by COVID-19. So many of us have lost friends. Many of you have lost family members. You may have lost your job, your business. Everything we do every day is to try to keep people safe and to prepare our community to safely return to a life that we recognize. So our thoughts and prayers remain with you. Let's start by looking at our data slide. So I'm going to share my screen real quick. I'm smart enough to do this. Okay, so this is our hospitalization rate. It's a chart that our community and our media partners recognize. You can see that we've settled down below 3% now. It's a very good outcome and a place that we want to stay. You can see our case count by age. Monday, when we did a 10-day look back, I think our average number of new cases per day was about a little more than 12 a day. So it's probably come down a little bit from that based upon yesterday's number. You can see that the distribution is pretty similar to what we've seen for the last, as we've tracked this the last 6 or 8, 9 months. And finally, maybe the slide that I want to draw your attention to is this is our Moderna doses administered
Mayor
slide.
Pope?
Yes.
This is Lacey. I am not seeing your slide. So
Okay.
make sure we see it since.
Okay, let's try this again. I'm sorry. Thanks for stopping me. Okay. Okay, Lacey, can you see the slides now?
Yes, sir.
Okay. So I'll start over. I apologize. I assume that you couldn't hear, you could see none of the slides. Is that correct, Lacey?
That's correct.
Okay, so from the top, our hospitalization rate is positive. So it's down below 3%. It's where we want to keep it. It's the result of a lot of people working hard, trying to slow the spread. And I think certainly vaccinations help with this too. You see our case count by age. The distribution here is something you should recognize. There are just many fewer new cases. I looked back on Monday at the previous 10 days, we'd averaged about just a little more than 12 new cases per day. Finally, in the slide that I'd like to really draw your attention to, these are Moderna doses administered. The blue being first doses, orange being second doses. You'll notice that yesterday was our slowest vaccination day since January 1st. We gave about 1,000 vaccines. I'm going to end end this and come back live, and I'll make some comments about that. Okay, so folks, we have more vaccine supply today than we have requirements for it. As Catherine pointed out yesterday, the governor's office and state health lowered the eligibility age for the vaccine. They basically opened it up to all adults. Please get your vaccine. Go today, go tomorrow, go Saturday, sign up online, walk in, whichever you prefer. On Monday of this week, over 50% of the eligible population in Lubbock County had been vaccinated. We've done very well. Let's not lose this momentum. Please help us push this over the finish line. This vaccine is safe and it's effective. I got my shot last Tuesday. I had the only side effect I had was my arm was a bit sore on Wednesday, but certainly worth getting the vaccine to know that I'm going to be safe. And that is that these vaccines protect us from getting COVID, but more importantly, if we were to get it from some outside chance, they're nearly flawless when it comes to preventing serious illness and death. And that's what we want to try to protect our community from. We will begin to wind down the Civic Center mass vaccination clinic in the next several weeks. Don't procrastinate. Please, please get your shot. Now, employers, listen to me, large and small. If you would like us to work with you to set up a time for your employees to come in and get vaccinated, let us know, okay? Reach out to the health department, call the mayor's office. We will work on getting you some an appointment. If you've got a church group that you would like to do the same with, whatever it may be, we are going to be flexible. We want to get these vaccines in the arms of Lubbockites and West Texans. Like Ron said, the best vaccine is the one that's in your arm. I'm so thankful for all of you. I'm so thankful for the trajectory that we're on as a community. We're safely reopening our community. We will continue to make decisions based on protecting lives and livelihoods. Please be hopeful. Back to you, Lacey.
Thank you, Mayor. Now we'll ask our panelists to start their videos so we can open it up for media questions. Remember, media members, you get 2 questions, 1 question and a follow-up if needed. And today's media question order is Matthew Stell with KMAC, Sarah Self-Walbrook, Christy Martinez-Garcia, Olga Aguero, Mateo Rosales, Matt Dotre, and Grace Morris. So let's get started with Matthew Stell.
Thank you so much, Lacey. Good to see everyone. My question is for everyone. Of course, with the governor allowing any adult over the age of 18 to now get vaccinated starting on Monday, is the city prepared for an influx, possibly a surge in people trying to sign up, get registered to get their vaccine? And if so, how so?
Catherine, why don't you start on that?
Well, first of all, we have vaccine to give. So that's the most important part. We will be able to increase the number of vaccination appointments available per hour for this week and next week. So that will allow more people to come through. We will also have all of our vaccination stations fully staffed at the Civic Center for this week and next week. So that allows us to have 22 people giving vaccine at one time, and we can see up to 500 individuals in 1 hour.
Got it. One follow-up question. Mayor Pope, and I think Catherine Wells, you also mentioned this. You said that in a few weeks, the vaccination hub center for the vaccines will close down. What'll happen after that? Folks want a vaccine. Will they need to go to a pharmacy, their hospital, their doctor? What will they need to do?
Catherine, you want to handle that?
It will be a mix. So we're going to see a transition from these hub sites to vaccine moving into providers' offices and pharmacies. So it will be available to people by making an appointment and going in to either a doctor's office or pharmacy. The vaccine will still be free, regardless of where you get it. And then the health department's going to change our focus and really go out to groups setting up, on a Saturday afternoon at a church or setting up at one of the community centers to really reach people close to their homes to ensure that they also have access to vaccine.
The only thing I would add to that, Matt, is that I think partners like United Supermarkets will continue to run their clinics. I had conversations with them yesterday. In fact, they're trying to find a way to maybe step up their effort. We want to take it to every corner of the town. So we'll keep on that track.
All right, got it. Thank you so much.
Thank you, Matthew. Now we move on with Sarah Self-Walbrook with Texas Tech Public Media.
Hello, everyone. My first question, Catherine, I'm really curious, as we've seen local vaccine supply outpace demand, what was the plan if eligibility wasn't expanded soon? Were we going to open that up locally anyway, or what was the plan for next week especially?
We were advocating with the Department of State Health Services and the governor's office to open up. That was really the goal, is to continue to follow, the state guidelines. And, if they didn't open it, then we wouldn't be able to do this right now, but really pushing to have that change. And thankfully they changed it.
Interesting. And then again, as eligibility opens up, we've still seen comments from people who say they're having a hard time getting an appointment in town for a shot, whether that be at pharmacies, I think seems to be the biggest issue. But what barriers to access are we dealing with, and what are we doing to fix those? I'm sure going out to those smaller groups here in the next few months is one of those solutions.
Well, we've done a couple of things. There are appointments available if you call the health department. I have at least 5 people on standby right now ready to answer that phone. They will work you into an appointment, especially if you're older. If you're 70, 80, 65, we're going to find you an appointment at that clinic, even if it means double booking a specific time. We've also launched our Vaccine Ambassadors program. So I have members throughout the community that can make appointments directly for people where they don't have to call. And, you know, we still have select a seat available for those with computer access.
The other thing I would add, Sarah, let me add to that,
Yeah.
free transportation. So you go to City Bus on Demand or call City Bus and we'll pick you up and get you down to the Civic Center and make sure we get you vaccinated and get you home. Okay, so we're going to continue to try to take every bush out of the road, every barrier out of the way. We want people to have access to the vaccine.
That's a great note, Mayor. Thank you.
Okay, thank you, Sarah. Now we move on to Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. Catherine, I want to let you know that I've heard nothing but positive remarks about such a speedy process and so organized. So thank you and kudos to all the folks that are helping you. I've even had folks telling me that there's bilingual people. I mean, I've just heard nothing but great things. So thank you for that. I think, I'm not sure who said it, but somebody said that 50% of Lubbock County has been vaccinated. Is that 50% of eligible folks have been vaccinated? I'm unclear on that.
That's correct. That's from the state's website. A little more than 50% of eligible. That was as of, it was on Monday, so I'm not sure when the data refreshed. Catherine might be able to add to that, but it was eligible, folks eligible for the vaccine.
So that doesn't include the newly eligible individuals of the 18 to 50 without an underlying health condition.
So what is that percentage exactly for the city of folks that have been vaccinated?
The percent of fully vaccinated of everybody 16 years and over is about 21% is what I saw last night on the state website.
So my next question then is, what populations are we having difficulty reaching? Also, you know, because some groups have been motivated by politics still, there's a little bit of resistance. So are there any specific groups that you're really trying to target that we can help to get that message out? Or, you know, what is it that you're finding some resistance? What groups?
Our biggest group that we targeted this last week was making sure that our homebound individuals knew that vaccine was available and it could come to their house. So we worked with Meals on Wheels and actually sent out flyers with all of the meals to get individuals to be calling us so that we could set up those appointments. As we wrap down the hub site, we are really going to be looking at our data and mapping where in town people have gotten vaccine, or who we can actually map by address who has received vaccine. So we really want to look at those areas where there's populations that have not received the vaccine yet.
Okay, because
my focus, Christy, is the group I'm focused on are those people that haven't got the vaccine, all of them. And you know, we just have to continue to advocate and remind people why it's safe and why it's important. That'll continue to be my focus.
great. Okay, well, I appreciate y'all's time. Have a great week.
Thanks, Christy.
Thank you, Christy. And Olga Aguero with El Editor is next, but she couldn't be with us today, but she sent me her questions to read. And this question kind of goes along with Christy's, a little different. With the vaccination now open to all adults over 18, do you feel the younger demographic will be hard to reach given their complacency earlier on in the pandemic? And is there a plan to better reach them with the vaccination message?
I'll start on that and let Catherine and Ron add to it. I do think that we'll have to be a bit more intentional as we go after the younger generation. We will be talking to our universities later this week and working on plans to partner with them to make certain that their students are aware of their eligibility and the fact that we have doses available. But I do think that's a good point, and our marketing committee from ALERT is still very much communications, I think they call themselves. They're still very much active, and we've asked them for their input as we broaden the eligibility to basically all adults. Catherine, what do you want to add to that?
Yeah, it's going to take, we want to bring vaccine to them after the hub site closes. So it's really partnering with both the universities and then also working with the schools and looking at trying to get our seniors vaccinated before they go off to college.
I know that the Health Sciences Center in the main undergraduate campus at Texas Tech is formulating a document to send out to everybody to go down to the Civic Center and sign up through Select a Seat to get their vaccine.
And I know that the City Communications and Marketing Department has been working with the university in the past week as well to partner up with them to try to reach the harder to reach demographics and a wider audience in general. So, okay, her second question is for Dr. Cook. As of right now, has there been any case of someone here in Lubbock catching COVID since being vaccinated?
Not that I'm aware of. Now, it is a possibility. Moderna and the Pfizer vaccine are about 95% effective. And the Johnson & Johnson 67% or so. So there's that gap, that 5% gap or 35% gap with 33% gap with the Johnson & Johnson, that individuals may come down with an infection in COVID. However, the good news is none of the individuals that came down in the study, none of the individuals that came down with a COVID infection after the vaccine needed to be hospitalized. That's the good news. It prevents you from going to the hospital. Pardon me. So get your vaccine. So the worst case scenario there would be you might get COVID, but not have to be hospitalized. But that's pretty rare.
Thank you. Next, move on to Mateo Rosales with the Daily Toreador.
Good morning. Okay, my first question is that on March 11th, the Office of the President announced to the Texas Tech community that they would decide not to do a vaccine clinic on campus. Is that changing as of recent, and will we be seeing a vaccine clinic on campus within the next few weeks?
I would say right now we would stick with that communication from the President's office. We will continue to partner, Mateo, with Texas Tech, and this the eligibility of the broader eligibility might provide us the opportunity to provide something on campus, but no plans for that as of yet. We're still focused on the Civic Center where we can most effectively and productively run people through and get the most vaccines in people's arms.
And my second question is, a lot of college students are concerned about the side effects of the vaccine, such as sore arms and becoming really tired afterwards. Is there a way that we can reduce these side effects?
No, Mateo, that's a great question. You might take some Tylenol or something like that. Some people would recommend you don't do anything, but some people say, well, Tylenol, a little bit of Advil may help resolve the side effects or certainly lessen them. They're very short-lived, less than 24 hours, typically maybe 36. And so the mayor said that he just had a sore arm. I had a sore arm. I felt a little achy the next day, but it didn't prevent me from going to work, or certainly wouldn't prevent you from going to class.
Thank you.
Thanks, Mateo.
Thank you, Mateo. Now we move on to Matt Dotre with the Avalanche Journal. A lot of Matts.
For sure, a room full of Matts. Good afternoon, everyone. Dr. Cook, are we at the point yet where we're anxious or we're nervous about the number of people not pursuing a vaccine? And can you talk a bit about, like, what happens if enough people don't get the vaccine long term?
Well, obviously, the long-term answer there, Matt, is that the virus will just continue to smolder in the community and continue to infect individuals. The worst case scenario there is it infects somebody that won't do well with the infection and end up in the hospital. We don't want that. Nobody wants that. So the goal there is to encourage people to come down and get their vaccine. It's a safe vaccine, very, very safe. All three of them are safe. And so we need to continue to have the discussions and say, please come get your vaccine. It's safe. Let's stop this virus.
And you still believe that enough people to reach herd immunity get that message or will get that message?
Well, I hope so. I mean, that's the whole purpose of our conferences like this, press conferences. We're all pushing it on our social medias. Hopefully people will come get it. And then, there is that risk of the long COVID syndrome that certainly nobody wants either.
Mm-hmm. Okay. And okay, Ms. Wells, so you said about 21% of individuals over 18 have received the vaccine, or you quoted numbers from the state. Anyway, the point of me saying that, so there's still a long way to go, obviously. So I guess I'm kind of curious why the hub is closing, because the Civic Center seems to be working so well. Was this your decision, or is the hub closing because there's events coming at the Civic Center and you're kind of getting kicked out?
Well, I think it's a change in the amount of the availability of vaccine to the community. The state was really focusing on giving it to one provider. Now it's time for those doctors' offices and pharmacies to have the vaccine. We have enough of the population vaccinated now that I don't think they will be overrun, and they'll be able to handle the rest of that. And that really gives us a lot of options. I mean, if you think about everywhere there's a United Pharmacy in town, we have it dispersed out throughout the entire community. A lot of, everybody goes to the grocery store. That gives a lot of access without people having to worry about driving. And they know their pharmacist and trust their pharmacist.
Matt, if we still had 5,000 or 6,000 people trying to get in line for 3,000 or 4,000 shots, we would still be doing it at the Civic Center. And if we see a resurgence in demand, we'll reconsider. I mean, we're going to pivot and do all we can to get these doses in the arms of Lubbockites.
For sure. So are you all seeing more people choose pharmacies now than the Civic Center?
We're just seeing less. We're seeing a little less demand, Matt. I mean, you saw it yesterday. So that's why we advocated for the state to broaden the eligibility.
Okay, thank you all. I appreciate it.
Thanks, Matt. And last but not least, we have Grace Morris with KLBK.
Good afternoon now, everybody. Hope you all are doing well. Kind of piggybacking off a little bit of what Matt was talking about. Why do you think we've seen this downturn in demand? Do you think it's, eligibility requirements being too high? Is there a large population still hesitant about the vaccines? What are your thoughts?
Catherine, why don't you start on that? We'll all jump on that one, but you start.
I think we hit a bit of a saturation point of those people that were very eager to get their vaccine. And I think some people know it's important, but they have other things to do. So now we're really trying to encourage, people not to wait and come in and get their vaccine. I think a lot of people thought it would be hard to get an appointment. And I want people to know that, we have appointments, we have vaccine available for you.
Yeah, I agree. Part of it is because our vaccines are working. And we've had a number of individuals in our community. 50% of our eligible people have had at least one dose of the vaccine. That's not herd immunity, and then there's the people that have had COVID that haven't received vaccine, where the virus then can't be transmitted to somebody else. Now, that's a very difficult number to get a hold of. And so our numbers were coming down, and I think probably fewer people saw the acuity of the disease. When we're at our peak, our hospitals were full. Lots of people knew people that were really sick, and now I think our numbers are coming down. So I think people, unfortunately, are backing off on the urgency to come get their vaccine. So that's our goal. We are not out of the woods. And so we need to continue to get our vaccine.
I can add very little to that. I think I sort of lean towards that idea that a lot of people are sort of following the conventional wisdom that our community gets safer every day, and it's safe enough that they don't have to get their vaccine. And that's something that we really want to encourage those people to rethink that. Don't put yourself at risk.
Okay, thank you. And you guys touched on it a little bit, but we still have some ways to go to get everyone vaccinated. But what do you think the timeline is maybe for reaching that herd immunity?
No, Ron.
That depends on our community coming out and getting vaccinated. And so, again, it's hard to say. We need 70% minimum probably. So I think, but remember that 50% that I quoted that hasn't had at least one vaccine dose given was only for the eligible, at the time, the eligible people. So that was 60 or 65 and older, not the 50 and older, and a little bit. But we still need people to come out, the 18 to everybody else. If you're over 18 years old, please come out and get your vaccine. Let's stop this virus. Let's don't have to deal with it again.
All right. Well, thank you guys so much. We appreciate all the work that you're doing and getting everyone vaccinated for sure.
Thanks, Grace.
Thank you, Grace. And this concludes.
Hey, Lacey, I might mention that I'm not very good at giving the vaccines, but we have a lot of younger media members. And if they want you to schedule, I bet Catherine could schedule me to do the vaccinations on some of those guys. I mean, Dotre and
that's a
Grace.
Perfect video opportunity for them.
Yeah, so just as an option.
Dr. Cook will have to sign off on that.
I'll teach you how to do it. I'll be
that
right
means
there.
if he has to, if he has to sign off, that's not going to happen. Please, though, let's. I only say that tongue in cheek. Let's get everybody vaccinated. Sorry, Lacey.
That's okay. And as a former media person myself, this is a perfect example of y'all being the MOSs that you need for your newscasts.
And this is Matt Stell, and I would definitely sign up for that.
Grace,
camera.
Christy, I know you're still listening. Where's Karen? Let's get Karen down there.
Karen's on vacation. She would do it.
Okay.
She would definitely do it. One thing we want to remind everybody, and this is what we're seeing on our social media, a lot of people still don't realize it's free. It's free, it's safe, and it's easy. So take advantage. So this concludes our news conference. Thank you all for joining us, and thank you to our panelists and our interpreter for all the information on COVID-19 and vaccines here in Lubbock. Please refer to the City of Lubbock social media sites or your favorite media partner of ours. We hope you have a good week, and we'll see you